What we're committed to as organizations together is that real triple aim of healthcare. How do we improve the individual's health and their experience of care? How do we improve the health of population? And frankly, how do we reduce per capita costs of care? There's no better time to be here in healthcare and to be collaborating in these ways. I mean, we were at risk of having a tragedy of the commons where everybody was trying to do it their own separate way. And so that's what we anticipate. This collaboration can make us much more accountable collectively to the communities we serve. We have to work collaboratively together, and we set up a system where actually we're getting the best experts on a care condition, for example, like breast cancer, or for example, like stroke care. Getting those people together to work together to say, let's define what the best care looks like based on all the available evidence and based on all that we know and all our experience. And let's follow that consistently. And let's let the variation not occur because I think you should have antibiotics for 5 days and somebody else thinks you should have it for 10. But that the experience varies because of the individual attributes of the patient, not the attributes of the clinician. Blue Cross Blue Shield help us to put some of the structure in place on data collection and things like that, helped invest in that, and helped incentivize us on improving the care of those with pregnancy. So much so that we actually made sure that we were following the best evidence of care and were able to reduce unnecessary cesarean sections by making sure that women didn't have early inductions of labor inappropriately. So when we calculated that out, that meant that over 200 women cared for in our system. We do about 15,000 deliveries in Allina Health per year, but more than 200 women didn't have cesarean sections because of some of the quality efforts we did that Blue Cross Blue Shield helped support. So quality and costs are two sides of the very, very same coin. So it actually serves the employers by making their employees healthier and happier and lowering the cost of care. For example, in the one I gave earlier about the cesarean sections, that means that women were happier, their labors were less long through this initiative, they had fewer cesarean sections, their experience of care was better, and it was less costly. Less babies in the NICU, less women with surgeries. So more efforts like that to make sure that we're addressing, through quality improvement efforts, the cost of care as well. We're about providing health and health care and keeping people well. So I think that that's what this evolution will be. First it was about transactions and negotiating pay rates. Then it was about aligning our incentives. And now it's about we are responsible for the whole of our community and its health. We will do the best we can, and we will continue to do great care of responding to illness, but also our big charge is keeping people well. And how do we best support them and helping them keep themselves well?